Thank you for taking the time to watch this video. We're going to discuss what you should expect and what you should have as far as your ultrasound guided carpal tunnel release is concerned. Now, some of you are watching this before you undergo the procedure, and some of you are watching it after you already underwent the procedure. Okay, most of these we're going to do in the office here under local anesthesia, but there's a small number of you in whom we'll do this in the hospital setting. And the post-operative instructions apply the same either way, and so I want to take a minute to review this with you. You'll also notice that in addition to this video, you should have some discharge instructions that are written down. Okay, those instructions are on a sheet that looks like this. In addition to the fluorescent sheet, this one right here that we talked about that has some explicit discharge instructions on it, you'll also have the same information presented in this format, okay, in a graph. And that way, you'll have at least 3 different ways that you can reference this material. You can reference it here in our video, you can reference it on the fluorescent sheet, okay, and you can also reference it on the graph. They all have the same information. So what I'd like to do is go over that information with you right now. The other thing that you should also have is one of these pamphlets right here. Okay, this is a pamphlet that goes over ultrasound guided carpal tunnel release. We got it from our office. If you don't have it, please ask. I know a number of you have questions about the procedure. You'd like to go home and read about it some more, or maybe you have family members that want to know more about it and they weren't able to make it to the visit today. And so I want to make sure that you have that resource available to you as well. And of course, you can always check at our website for more information about the procedure and other things, okay? You should be able to find this video. If you lose track of it, you should be able to find this video on the website on our and on our YouTube channel, okay? So let's go through the post-operative instructions. So a couple things. Number one, you're gonna have a small bandage on your wrist, okay? You're going to have basically what amounts to a fancy band-aid that goes right around here, and then you're going to have a bigger bandage on top of that. That bandage, the bigger bandage, stays on for the first 24 hours. You can take that off the day after the procedure. It is waterproof, so unless I tell you otherwise, you can shower with that on. And you can shower the day of surgery if you want, okay? After you take it off, then you can shower, you can get it wet, but don't, please don't take a bath, okay? Don't take a bath and don't go swimming until you're cleared by me or by Steve, our PA, okay? That's so that you don't end up with a wound infection. It is okay to get it wet in the shower, okay? Soap and water is fine. Do not use alcohol, do not use hydrogen peroxide, and do not use Neosporin on your wound. They cause all kinds of problems. So regardless of what anybody else may have told you about this, as far as my procedures go, please don't use alcohol or hydrogen peroxide or Neosporin on your wounds, okay? The next question a lot of people have is activity restrictions. What activity restrictions do I have after this procedure? Other than the swimming and the bathing, there are no activity restrictions. If you feel like you're ready to do it safely, then go right ahead. That's one of the big advantages of the ultrasound guided carpal tunnel surgery. There aren't any activity restrictions. Now that doesn't necessarily mean that that you will want to go do a million different things, okay? But you're not going to mess anything up by going and lifting 50 pounds. Now you might have some oozing from your incision for a few days and afterwards. That's normal, okay? You don't need to worry about that. Just make sure you clean it up. And some patients will choose to put another bandage on top of the one that we put on there just so they don't make a mess on their clothes, and that's okay as well. Do make sure that if you use another bandage on top of the steri strip that you change that before you get in the shower, okay? So take the bandage off before you get in the shower, go ahead and wash as you would any other time, and then dry it off and put a new bandage on afterwards, okay? Those are some of the important things to keep in mind as far as activity goes. You will find that if you keep your hand elevated, that it won't swell as much and you'll have less post-operative pain. This procedure isn't pain-free, but most patients say that it's a lot easier than they thought it would be. And you'll also find that you shouldn't need anything more than Tylenol and ibuprofen to help with your post-operative discomfort. You will be sore, okay? You did just undergo surgery, but it shouldn't be horribly painful, Ibuprofen and Tylenol should be sufficient, and most patients tell me within a few days they're really not taking that even anymore. Okay, it's not unusual to have a little bit of postoperative weakness because you have some swelling in there, which affects how the tendons work. That's also normal as well, so no need to freak out about that. Okay, let's see. Let's go over a few other things as far as your discharge instructions go. Okay. Ice and heat, okay? So a lot of people want to know about ice and heat. So when is it okay to use ice? You can use ice for the first 48 hours. Do not apply it for more than 20 minutes an hour, okay? But you can use it in the first 48 hours. After the first 48 hours, do not use ice any longer, okay? Again, you'll notice here on this sheet, right down at the bottom, has instructions about ice and heat, okay? Ice is here, heat is over here. Okay, do not use ice after the first 48 hours. The reason for that is that ice will decrease swelling, and the way that it decreases swelling is it causes vasoconstriction. It causes clamping down of the blood vessels, which decreases blood flow to that area, which decreases swelling. The problem with that is that we want your wound to heal as quickly as possible, and if you're decreasing blood flow to that area, you're going to slow down the healing process. What we want to do is increase blood flow to that area, and we do that by applying heat. Okay, now that may be contrary to what you've been told by other doctors or physical therapists, and that's okay. I'm telling you what you should do with regards to the incisions that I made, with regards to the wound that we created. These are the things that we have found in our practice are most helpful for getting patients to recover from what we've done as quickly as possible. If a different surgeon tells you something different about the procedure they did, I would recommend that you follow those recommendations, okay? But these are the recommendations I'm making. These are instructions I have for you as it pertains to your surgery that I did for you. And so please, if you want to get the best results possible, you want to get the results that we expect, following these instructions is really important to that, okay? Couple other things. You will also be sent home with some antibiotics, okay? Those antibiotics are important for decreasing the risk of infection after surgery. Please take them until they're done, okay? That's important to do. You should never hear the phrase leftover and antibiotics in the same sentence. So please take the antibiotics as instructed. As far as the Tylenol and the ibuprofen are concerned, I want you to take that around the clock, whether you have pain or not. It's primarily so that we decrease inflammation and also so that we decrease the risk of complex regional pain syndrome later on down the road. You'll only need to do that for a few weeks, but if you take a look at your instruction sheet, you'll see on there specifically how long and what you're going to take. Now, this is important. A lot of people will say, well, so I have to alternate the ibuprofen and the Tylenol, right? And that is not correct. Okay, I recommend that you get the extended release Tylenol, and you'll see a picture of that here in a second. Okay, get the extended release Tylenol and take that every 8 hours. At the same time that you take that, I also want you to take the ibuprofen, okay? They don't work the same way, and so it's okay to take both of them together. And you'll find that it's more convenient. Instead of having to wake up in the middle of the night every 3 or 4 hours, you could sleep through the night and take this together. That's important to do. Again, we want to decrease the risk of nerve-related pain later on down the road, and we also want to decrease the risk of any other problems, okay? And of course, we want you to be comfortable as well. And then the last thing that I want to mention is the high-dose vitamin C. Okay, it's important to take that. That is not a nutritional supplement. We're not doing this because I think you have some kind of nutritional deficiency. The reason for the high-dose vitamin C is that in some studies it's been demonstrated that high-dose vitamin C right after surgery can decrease the risk of certain types of chronic nerve-related pain later on down the road. And so while it hasn't been studied specifically in carpal tunnel surgery, we found it to be helpful in other types of nerve-related surgery. And so it stands to reason that it should be helpful here. So I would recommend that you take the vitamin C, 1,500 milligrams once a day for the next month, okay? And you'll see that, again, here on this sheet. You'll see the high-dose vitamin C on there. So please, please do that. Some studies have suggested that you only need 1,000 milligrams a day. Other studies have suggested that you need 2,000 milligrams a day, so we chose 1,500 to kind of split the difference. Okay. Again, as always, you have my cell phone number if you're watching this after the procedure. So please don't be shy. Text me or call me if you have any questions or concerns. You can also call the office if you have any concerns about what we've done for you. Don't be shy. And please take care and be safe out there, okay? Thank you.